Good morning, friends. Many patients are brought to psychiatrists with complaints of memory loss and disorientation. The relatives will come and say, Dr. Saab, he is behaving abnormally. He is not remembering what he ate today morning at all. They also substantiate with the history that Dr. Saab, he used to drink alcohol for about 20 years. But 15 years ago, he had a severe fall. He met with an accident. He had a head injury. Now, for the last 6 months, we notice a personality change in him, in his thinking, in his behavior, in his perception, in his emotional expression. What are the causes of such personality changes in an individual, my friends? Trauma. Any trauma to the brain, to the head, can months later or years later produce a personality change. Closed head injuries, it can produce. Chronic subdural hematoma. In any alcoholic patient who presents to a psychiatrist with abnormal behavioral pattern, it's mandatory that we should do an MRI brain scan to rule out what? To rule out subdural hematoma. I have had instances wherein patients had a head injury of 15 years ago and now they present with abnormal behavioral pattern. And when I did an MRI brain scan, there was a subdural hematoma. I summoned a neurosurgeon and asked him to drain it. The dictum in surgery, mark my words, my friends, the dictum in surgery is, let pus be there in the brain. The answer is incise and drain. Let pus be there in the brain. The answer is incise and drain. Yes. Vascular causes like infarction of frontal lobes, temporal lobes infarction, basal ganglia or thalamic infarction, they all can cause personality changes. Brain tumors, especially we have frontal tumors or temporal lobe tumors, which can present only with apathy, then lack of emotional expression, almost sort of an emotional blunting. Patient does not have any expression at all. He can have an empty, a vacant expression on the face. Then dementia disorders, they also can present to a psychiatrist with only personality change. Alzheimer's, Pick's disease, Jakob-Creutzfeldt disease, Huntington's disease, frontotemporal dementia, Wilson's disease, normal pressure hydrocephalus. There are some people who pronounce it as Jakob-Creutzfeldt disease. No, I remember the doyen of neurology, the great neurologist, late Dr. Noshir H. Wadia, pronouncing it as not Jakob-Creutzfeldt disease, but as Jakob-Creutzfeldt disease. Let the students pick up this pronunciation. Infectious conditions like neurosyphilis, AIDS, post-viral encephalitis, it can present only with personality changes. Are there any metals which, if they produce poisoning, they can produce a personality change? Yes. Remember, metal poisoning, mercury poisoning, manganese poisoning, lead poisoning. What is lead poisoning called as? Plumbism. It also can produce personality changes. Are there any other conditions which can make a person to develop personality deterioration? Yes. One is multiple sclerosis, also called as disseminated sclerosis. Then paraneoplastic limbic encephalitis. The commonest causative factor which perhaps I and you miss is B12 deficiency, B12 deficiency and B12 deficiency. I am insisting on this, I am pronouncing it thrice because more often than not we miss it. Hence, any person who comes with a dementing process or sort of a personality change, please do investigate and see if his blood sample lacks vitamin B12 therapeutic levels. There is something called as intellectual personality syndrome. In such conditions also, personality changes occur. My friends, as a clinician, be it a general practitioner, be it a general physician, be it a psychiatrist, be it a neurophysician, we have to remember these causative factors, these etiological factors in our mind whenever we encounter a patient with memory lapses, deterioration in the personality, disorientation, etc. Thanks a lot for watching the video. Please do share it. Please like it. All the best. Thank you. God bless you.